Vocalis Track, a vocal biomarker for detection of shortness of breath. Currently, there is no tool to measure this directly. That's why Vocalis developed a precise, easy-to-use tool for remote detection of shortness of breath. Let's see how it works. After Richard installs the app on his smartphone, it prompts him to make a short recording and answer a few simple questions about how he is feeling. The app then uploads the voice recording to its secure cloud platform, where it is analyzed by the Vocalis Track AI engine. Back in the office, the doctor can check the web-based dashboard to see if Richard's shortness of breath has worsened, improved, or stayed the same. Now, if Richard's shortness of breath gets worse, his doctor can see this from her office. She can contact him to ask him to come in for a checkup, instead of waiting for him to end up back in the ER. Vocalis Track for remote detection of shortness of breath.
Now I'm pleased to introduce Vocalis' President and CEO, Tal Wenderow. Tal, Vocalis uses AI to analyze people's voices to determine if they have COVID, all through a smartphone. So can you tell us how this works?
Happy to do that. So the way we're looking into that is we're looking into voice as a sense of a body that was so far underutilized in healthcare, right? We all know about the health of our loved one just by speaking with. You'll know when I feel bad and so forth. So what we're trying to do is take that voice and provide insight and ability to manage and triage diseases just by the voice. And the way the technology works is we're analyzing it based on machine learning and deep learning algorithm. It's all about big data. And we analyze the voice, the acoustic of the voice, but not the content of the voice. So we don't care about to speak about the weather, the baseball, football, NFL, all the sports that we don't have, but we all care about the acoustic of the voice. And we correlate that to disease and conditions. And it's very fascinating because I joined the company last year, and the technology is actually converting the voice to an image and then analyze the image. So using a sophisticated image processing technique to correlate to voice to condition, disease, and symptoms. And to be honest, before I started, I thought it was science fiction, right? Meaning my wife has checked that. So I did my own checking with physicians, and we had done some clinical trials with the Mayo Clinic, with Geisinger here in the US, and with Maccabi and Sheba in Israel. So, we're confident about that correlation. And now we're a pre-commercial company. Now we need to bring it to the next phase.
So what did you do before Vocalis, and how did you come up with the concept to use patients' voices to be able to track their health?
Before Vocalis, I started a robotic company in the healthcare, doing vascular robotics. Moved with the company from Israel to the Boston area to do remote procedures. So how do you place a stent remotely when the physician and the patient are not in the same room? We're actually in Vocalis trying to bridge the same gap. So the Vocalis, what's interesting is it's a merger of two Israeli companies that was led by Amon Fund. Some folks are here like Roy, Yaron, and Bartley on the call I saw. So they, I don't want to say forced us to do that, right? Because it's all about people, but they forced me to meet Shadi, who is my partner in crime, and he's a physician that was the CEO of the other company that was practicing medicine and analyzing and diagnosing patients just by listening to their voice. And he figured, if I leave medical practice, I can probably impact far more patients than just keep on practicing. So he left medical practice, started the company, and our first indication is actually in respiratory disease, so ability to detect shortness of breath. And from that, we're actually moving to COVID, that we got early results literally a couple of hours before this call. So I'll try to do a little bit teaser to the extent I can share. But we're focusing on respiratory disease first, then other cardiovascular disease, but voice carries information on a lot of disease, not just respiratory.
Where do you see voice diagnostics going, and what's your plan going forward?
So the goal is and we all have our own personal passion, personal interest in how to change and impact lives. I see voice as literally as this discussion, right? And that's the reason I joined this company and left my previous company. What I call the triangle between voice, which is an exploding market, right? It's the next iOS, people are saying, or operating system is voice. The second one is AI, as you mentioned in the poll, and the third one is digital health, and all convert via the voice, in my opinion. And we see voice as what we call the first line of defense. Whether it's today in COVID-19, for example, one of the use cases we're looking into is before you go in and issue your boarding pass, you can do a voice check, and I can tell you the risk of COVID-19. And we have early results that support that. Now we're actually starting pilot to that. And then if your risk is high, we'll say, go do a test. If your risk is medium, we'll say, go from that door to the airport and do an extra testing over there. And if the risk is low, just here's your boarding pass, go forward. So we're trying to help that ecosystem of how to open business back again. We got approached by a lot of businesses. Can you help? Because fever, as you know, temperature is not that sensitive. There are studies that only 30% presented with fever to the ICU of COVID-19. So we see voices, because it's so passive, scalable, easy to access, and cost efficient, is that early on raise that flag. And when you do that, you add other device ecosystem. Voice is not a standalone solution, right? But allow you to pre-diagnose, allow you to get insight on the individual. So if I want to know about myself, think about 23andMe, which is not a good name right now, given their layoff last couple of months. But how can I provide insight to the individual on a risk for several diseases? And we use that based on database we have from Maccabi Healthcare in Israel, and we're acquiring more and more with the Mayo Clinic. But as an example, we did a trial in the Mayo Clinic that found correlation between voice and pulmonary hypertension, which is a very hard to diagnose disease. And the goal is from 20 seconds of discussion, like this discussion can give you insight about what's your risk of pulmonary hypertension, sleep apnea, CHF, and so forth. And we're building all of that. And then when you have that, then by using your phone or your AirPods or even your car, you can monitor your health on a continuously matter all the time. And raise a flag when I see deterioration. And the flag can be to myself, can be to my caregiver, or can be to my physician. So we see voice follow that entire continuum of care, pre-hospitalization, post-hospitalization, flagging risk, just as that first line of defense.
Is there a baseline criteria for shortness of breath that indicates COVID-19 versus asthma or other respiratory conditions? And how does the system discern among the various types of conditions that trigger shortness of breath besides COVID, such as COPD, emphysema, asthma, etc.?
Yeah, great question. So the shortness of breath is a symptom, right? It's not a disease. So it can be the same shortness of breath, whether I'm climbing up the stairs, I'm running a marathon, or having a chronic disease. So in the shortness of breath, we're targeting those chronic patients right now. And we want them to measure that every morning initially. And that's a unique measurement of shortness of breath, which is, as you know, there's no good tool for that right now. And the challenge is not only to measure that, because if there are physicians here on the panel, they can say, oh, I can detect shortness of breath. But how do you get that access to the patient on a daily basis? And how do you get that dashboard? Because if you ask me, assuming I have shortness of breath, what was my status yesterday? I'll say, yesterday was good. And the day before, okay. And what about the day before? It was good. So how do you compare that good when it's very subjective to that shortness of breath? When we looked at what drove us to go into COVID-19, besides being a respiratory disease, is early data suggested that shortness of breath is a unique symptom of COVID-19 compared to common cold and flu. So we said, that's a good way to use our tool right now. We are not FDA cleared yet. And if you take an example of Prime Minister of UK, Boris Johnson, he had a physician 24/7 that knew exactly when to take him to the ICU. Most people don't have that privilege. So they use shortness of breath as a trigger to get patients to the ICU. So we think that can help with COVID-19, not because it's COVID-19 related specifically, just because it's a general symptom. What we're working, and what I mentioned, we have an early results, is we're working with in Israel with Mafat, which is the Israeli DARPA, and Sheba and Rabin hospitals, is to get a dedicated vocal biomarker for COVID-19, unrelated to that shortness of breath, which is unique to that disease specifically.
How do you exactly detect the shortness of breath from a person's voice?
Yes, so without disclosing all the secret sauce, and full disclosure on my end, I'm not a technology guy. I have smarter people than me in the company. The way we do that, initially, we ask the patient to count from 51 to 70, and we measure and we apply machine learning and deep learning algorithm. The way that person counts, the pauses, the actual tonation of that, and we have an algorithm to calculate that. We're also working to translate that counting into free speech, because eventually you want it all by free speech. But that's part of the algorithm that we built internally to do that. If you ask our data science, and I forgot to mention that earlier, they need data all the time, right? Meaning every time I said there's enough data, I call them data snobs. They need more and more and more data. So first, everyone that wants to donate their voice, on our website, there's a link. You can go online, fill a questionnaire and a symptoms check and voice. And the more data we have, we correlate it with symptoms and with COVID-19. So we use data both from the crowd, but also we're doing clinical trials right now. As I mentioned, 2 hospitals in Israel. We're in discussion with the Mayo Clinic, Geisinger, and other usual suspects here in the US. So it's a combination of peer review, internal, and at the end of the day, the market will validate, and that's where we are as a company, launching pilots right now to validate that.